In December 2018, the governments of Senegal and the Gambia officially launched a joint campaign to distribute 11 million mosquito nets to fight malaria, dubbed the Senegambia Malaria Initiative. This is the first cooperative effort to synchronize nationwide mass net distribution on both sides of an international border. The launch in 2018 took place in Kerr, Senegal, near the Senegambia Bridge and crossing point of Farafenni, symbolizing the commitment of both countries to join hands in the fight against malaria and accelerate progress in the high transmission cross-border region. The effort is a key part of Senegambia Malaria Elimination Initiative Agreement signed between the two countries in December 2018. The Minister of Health in the Gambia, Dr. Ahmad Lamin Samate, and the Minister of Health and Social Action of Senegal, Abdoulaye Diouf Sarr, met at Karang this time to distribute bed nets to citizens of both countries. The Gambia Minister of Health, Dr. Ahmad Lamin Samad, says over 11 million bed nets will be distributed in the next 3 months.
Today we are proudly gathered to officially launch the joint mass distribution campaign of the long-lasting insecticide-treated bed nets, also called LINs. This is going to be across the nations of the Gambia and Senegal. Over the next 3 months, over 11 million LINs will be distributed at the community level, free of charge, to the populations of our two countries. Not only is it a significant milestone for our two great countries, it is the first synchronized national-scale LIN campaign carried out across the two sides of an international border.
The Gambia has considerably progressed in the fight against malaria. The overall malaria parasite prevalence in the country is only 0.1% compared to 4% in 2010, indicating significant decline of more than 74% in all the health regions of the country. Minister Samate also says sustaining malaria control efforts is an investment in government.
Investing in malaria is about saving lives and reaping far-reaching benefits for our beloved countries. Sustaining malaria control efforts is an investment in development. Continued investments in malaria control now will propel malaria endemic countries towards near zero deaths by 2030 and achieving the sustainable development goals, especially those related to improving child survival and maternal health. Chairpersons, honorable members, ladies and gentlemen, a lot has been done in the control of malaria in the Gambia. Malaria prevalence has reduced from 4% in 2010 to 0.1% in 2017. The incidence of malaria has reduced by 74%, and mortality due to malaria has drastically reduced up to 50%. We are now embarking on a new era in the fight against malaria, one that will ultimately see malaria eliminated in this region.
According to Severe Malaria Observatory, malaria is an endemic throughout Senegal, and 100% of the population is at risk of the disease. The number of malaria cases declined 38% from 2015 to 2019, and the number of malaria deaths decreased 7.1% in the same period. The Senegalese Minister of Health and Social Action, Abdoulaye Diouf Sarr, who also attended the bed net distribution ceremony in Karang village on Sunday, urged the people to use the bed net to save lives.
am ngeen rôle bu am solo ci biir famille mbir mi nag ñett la mooy moustiquaire yi leen jox ngeen di ko utiliser at mi yëpp non seulement ngeen di ko utiliser at mi yëpp mais na ko waa kër gi yëpp utiliser mais bu ko waa kër gi yëpp utiliser itam na ngeen ko utiliser guddi gi yëpp parce que bu fekkente ne benn bés manqué na si at bi rek bés boobu mën na nekk bés bi xamante ne fa la feebar bi duggee bu fekkente ne am na kenn si kër gi ku ko manqué rek kooku ko manqué si kër gi mën na nekk bunt bi feebar bi du duggee bu fekkee guddi gi am na benn minute bu mu manqué rek minute boobu mën na nekk minute bi feebar bi duggee bon nag jigéen ñi ak famille yi ñett yooyu laa leen di dénk.
The World Health Organization has set targets in reducing malaria cases incidence by at least 90% by 2030 and reducing malaria mortality rates by at least 90% by 2030. The WHO representative, Dr. Desta, who also attended the ceremony, says they are further ahead in the progress in containing malaria.
We are still significantly further ahead in our progress to curtail malaria compared to the year 2000. This mosquito net distribution campaign is but one of the many steps we at global level can take to tackle the public health problem of importance. Over the last 2 decades, expanded access to who recommended measures of malaria prevention and control strategies, including effective vector control and the use of preventive anti-malarial medicines, has had a major impact in reducing global burden of this disease.
There were 241 million cases of malaria in 2020 compared to 227 million cases in 2019. The estimated number of malaria deaths stood at 227,000 in 2020, an increase of 69,000 deaths over the previous year, while about 2/3 of these deaths were due to the disruption during the COVID-19 pandemic. The remaining 1/3 of deaths reflect a recent change in WHO's methodology for calculating malaria mortality. The new case of death methodology was applied to 32 countries in the sub-Saharan Africa. Applying the methodology revealed that malaria has taken considerably high toll on African children every year since 2000 than previous thought. Reporting for Kerr Fatou in the Senegalese village of Karang, I am Buba Gajigo.